Hello everyone, welcome to Brainwaves. If you're looking for inspiration in the form of someone who lives successfully despite a serious mental health condition, look no further than today's interview with Katherine Switz. Katherine directs a consulting company that helps nonprofits and healthcare companies with strategic planning. And she's worked for several years in improving the economies of developing countries. Katherine has a Harvard MBA, and she graduated from Dartmouth, coincidentally, the same year that I did, in her case, cum laude. Katherine lives successfully with bipolar I disorder. And as a result of her experiences with this challenge, she's founded a network called the Stability Network, which is a network of leaders from around the country, each of whom lives with their own mental health conditions. And she's founded this network to fight stigma. Katherine is with us today to share her experiences and her plans. So Katherine, thanks so much for being with us today on Brainwaves.
Thank you, Brandon. I'm excited to be here.
Awesome. Yeah, I'm excited you're on. Oh, by the way, I wanted to mention to the viewers, I'm a part of the Stability Network, so I'm proud to be so. So thanks, Katherine, for founding that.
Yes, we'd love to have you. So glad you're part of it.
Great. Well, Katherine, I can tell by your bio that you care seriously about improving the state of our world, and you act upon that care, which I really admire as a quality. Were there some early experiences in your life that inspired your sense of social responsibility?
Thanks, Brandon. Both my parents were very civically involved, and in college I became involved both doing prison tutoring as well as staffing a crisis hotline. And I just came to understand the range of life experiences that people have and the importance of all of us being aware of those other life experiences, helping out however we can to improve the situation of the broader population.
Definitely. I know it's really important to understand that there are people out there who are dealing with their own adversity, and I really admire that you work to help those people. So, Katherine, when you were first diagnosed with bipolar disorder, what were the circumstances, and how did you feel about it then, and how did you start your road to recovery?
Well, looking back, I had symptoms of bipolar disorder beginning in college, but it really manifested itself for the first time in an extreme way when I had a manic and psychotic break while I was at Harvard Business School, and I landed in the hospital. And really that was the defining moment from which I then tried to climb back to a road to recovery. And one of the moments I remember most is my mom brought me the book, Kay Redfield Jamison's book, An Unquiet Mind. And that gave me an example or a role model of somebody who had also had an extreme situation, an extreme mental health condition, but was able to continue to work and get her life back. And so it was really the combination of having that very low moment in the hospital and having that concrete example of somebody who had been able to move beyond that really helped me realize that I wanted to get better and have a determination to do whatever it took to get better.
Excellent. Yeah, it's great to have inspiration from people who've done very well, and perhaps you'll go on to inspire people in the future yourself.
Thank you.
You're already inspiring me with all the things that you've done. I really admire what you've done. Yeah. So when you first told somebody about your bipolar disorder outside of your close family and friends, how did you do it, and why, and what was the outcome?
For the most part, for a long time, I just told people that I had a health condition without going any further because I was concerned about the stigma and the repercussions. But it was a time about 5 years after my first diagnosis where I was having to tell a manager that I couldn't do extensive international travel because of the sleep issues, that I really had to explain the illness in more detail. And the manager asked, "So what do you have?" And I remember the moment of having to say, "I have bipolar." And the interesting thing about each time I've shared my mental health condition with other people, often they don't have a context or a frame of reference to digest that information. They don't necessarily know what it means to have bipolar, while they might have a better sense, for instance, of what it means to have cancer. So it was that moment where I really felt like I had to come clean and share my experience. And since then, I've tried to take the risk more and more, realizing that if people like me don't speak out and share our experience and our condition in detail, others will have a harder time being open with their managers.
That's awesome that you do that. I'm glad it's working out for you to tell people about it, and I fortunately have had similar experience in telling people about my own condition, that people tend to be sympathetic and want to hear more. So you founded the Stability Network in 2013. What are your goals for the Stability Network, and how has it progressed toward those goals since you started it?
Yes, the Stability Network was founded with the notion, and again, just to recap, it's a network of stability leaders, leaders in the community and business and the nonprofit sector and academia who are coming together, who all have themselves a mental health condition and are willing to speak out about it. So our long-term goal is, by creating these examples of people living effectively with mental health conditions and role models, if you will, that other people who are struggling with mental health conditions will see a clear road to recovery and get on that path to recovery more quickly, such that they recover faster. And our long-term goal is just that people who have mental health conditions get the care they need, independent or regardless of stigma or challenges of access to treatment, and so that's really our long-term goal. In the short term, we basically do three things. First, I'm very focused on recruiting leaders like yourself who have themselves mental health conditions and are willing to speak out. So I spend a lot of time just networking and trying to find these leaders. And then the second important step that we do is really prepare these leaders to have impact. And third, we provide a platform, whether it's a website or media opportunities or speaking engagements, where these leaders can get out in front of people and tell their stories.
It sounds very powerful, and well, awesome. So if people want to learn more about the Stability Network, how can they do that?
Yes, the first step, people can feel free to email me, and that's kswitz@thestabilitynetwork.org. In just a few weeks, we'll have our first website live, and that will be at thestabilitynetwork.org. But I would be happy to provide more information to anybody who's interested. Just reach out to me directly.
Fantastic. kswitz@thestabilitynetwork.org.
That's right.
Awesome. Good. Well, Katherine, if people have any questions for you on the Brainwaves page after I post this video, are you ready to answer some questions?
Absolutely. I welcome them.
Fantastic. Thank you, Katherine, for being with us today, and I'll talk to you soon.
Thank you, Brandon, so much for doing this and for including me.
You're welcome. Talk to you soon.
Okay, thanks. Bye-bye.
Bye-bye.